Welcome again to our program. This is a health talk that is brought to you by the Oasis of Love International Center in Wolverhampton by the medical team. Today we're going to be talking about prostate cancer, and I have with me a very seasoned healthcare professional in the name of Dr. Bola Adedeji. Dr. Bola Adedeji is a practicing medical doctor of about 9 years. She's currently practicing as a general practitioner in UK, and she's a member of the Royal College of General Practitioners in the UK. So sit tight, grab your drinks, and enjoy the program. If you've got any questions, please feel free to drop it in the comment section, and we'll be happy to answer your questions at the end of the program. So, this is Dr. Bola. Dr. Bola, how are you? You're welcome to today's program.
Thank you very much.
I haven't introduced myself yet. My name is Tony Rabiu, as always. Welcome to today's program. So, Dr. Bola, we're talking about prostate cancer today. You're very welcome.
Thank you very much.
How are you doing?
I'm all right.
Good. It's nice to have you in our midst today. Thank you for sharing your time with us. I know you don't have the time, but thank you. We really appreciate it. So we're talking about prostate cancer. What exactly is prostate? What does it mean? Is it part of our body? What exactly is prostate?
Okay. Thank you for the question. I'm also happy and glad to be here to be sharing a bit of my knowledge with everyone. So you've asked about the prostate. What is a prostate? So a prostate is a gland. It's a very small gland in the body, and it's actually only found in men. It's said to be walnut shaped, so it's likened or similar to walnut. For anyone who who's seen walnut before, there's a picture of that on the slide. It's actually a gland that is just located just below the bladder in men, and it surrounds the tube that takes urine from the bladder or your water works out of the penis through the out of the body through the penis. Another good function that the prostate does is that it produces fluid and helps to make semen. Of course, we know that semen is something quite important in men and helps with making babies, if I could use the word. So yeah.
Wow, that's really interesting. Such a small thing, and it has so many usefulness in our men.
It does.
Wow. God is really awesome. So what is cancer then?
All right. So of course we're talking about prostate cancer, and the two are not quite, they are both, two words in one really. So cancer basically means an abnormal or uncontrolled growth of any part of the body, and if there is an abnormal or uncontrolled growth of some cells in a particular part of the body, then we call this cancer. So it could be based on any part of the body. So if it affects the breast, we call it breast cancer. If it affects, the prostate, it's called prostate cancer. If it affects the lungs, then it's called lung cancer. And of course, for this particular reason, tonight we will be talking about prostate cancer, which is a cancer that affects the prostate gland in men.
Wow, abnormal growth, you said. What causes this abnormal growth?
Well, obviously there's been a lot of research over the years, and most of the cancer cells that we've found so far, it's been quite difficult finding causes for most of them. And if obviously we're talking about prostate cancer tonight, for prostate cancer, there is actually no particular cause that's been found for prostate cancer. There's been, a few speculations, or should I say that there are some things that could actually increase the chances of men having cancer, and that would be, involve things like, number one, we talk about age. So in terms of age, we are aware that the older men get, then the larger the prostate gets, and also there's an increased chance that this the wall of the prostate or the lining of the prostate could then become, quite abnormal at some point, which then results in this abnormal and uncontrolled growth within certain parts of the prostate or in all of the prostate cells. And this could then, obviously spread to any other part of the body, really. So yeah, another thing that that's been pointed to be one of the risks for people having prostate cancer is our race or ethnicity, as we call it. So it's been found that black men have the highest chance of having prostate cancer compared to their white or compared to Asian counterparts. So it's it's the commonest in blacks, followed by the white or Caucasians, and followed by Asian. Another thing as well that's also been linked as one of the things that increases our chances of having prostate cancer is what's it called now? Family history. So if you've got a family member, so if you've got a father or you've got a brother who's got prostate cancer, then there's a high likelihood that one could have prostate cancer as well. I know that there's been a bit around, prostate cancer and all that bit, and obviously we're talking about it today because it's a pretty important topic, because we know that it's quite common in men. In fact, it's more like the commonest type of cancer in men in the UK. And in terms of cancer-related death, prostate cancer is said to be the second commonest cause of death in the UK, second only to lung cancer. So yeah.
Wow. These are facts that sometimes can be unbelievable, I found it that black men are actually the most, group of men that is susceptible to this prostate cancer. That is really scary, to be honest. And the fact that it's the second most, the commonest kind of cancer that could kill a man. Wow. Wow, wow. The Lord will help us. So with this cancer, so when you having talked about what causes it, what are the symptoms? What, as a man, what would you have to make you think, do we need to have a regular check every year for our prostate, or is there some signs that we need to look out for that makes us think, oh, we need to check this out? What's going on?
That's a very good question that you've actually asked. So there are quite a number of symptoms that men could present with that could make us suspect the chance of them having prostate cancer. And I'm going to be listing a few here today. That being said, I want us to also be aware that you may not always take these symptoms in isolation. And also to be aware that some of these symptoms may also be quite you could also notice the symptoms in other conditions that may affect the prostate as well, of course. So some of the symptoms that you may need to look out for in people who have prostate cancer. The first thing is that they may not have any symptoms at all. So prostate cancer is quite slow growing, and majority of people may just have it, grow slowly over the years. It's only a very few percentage of prostate cancer that's going to become aggressive and spread to other parts of the body. So for that reason, because it could actually just be in one part of the prostate and just grow slowly over the years, people in the early stage of prostate cancer may have no symptoms at all. And we call this, being asymptomatic. Another symptoms that people may then start to have is that as the prostate cancer starts to grow, gradually it could start affecting other parts of the body, and usually start with the area surrounding the prostate in itself. So I did mention earlier on, if you remember, that there's a tube, because the prostate is located just underneath the bladder, there's a tube obviously that goes through it, which we call the urethra, that carries urine from the bladder through this prostate gland out of the body. So sometimes when this cancer cell then grows, it could cause pressure on this tube as well, and sometimes it could leak, and that's what we then notice, that sometimes it could have blood in the urine. Sometimes it could also present with low back pain, yeah, and people could become very tired, very fatigued, very lethargic. In some cases, people, men could have what we call erectile dysfunction, which is difficulty with initiating or maintaining erection, yeah. If this then if the cancer cells then grow larger and larger, and men then start presenting with symptoms as well, they could start noticing some symptoms that we call lower urinary tract symptoms. So this could be symptoms of going to wee a lot, very frequently. That could be, a man waking up several times at night because he just needs to go to wee. It could also sometimes be because men could also sometimes present with that urge of, oh, I need to go to the loo right now. If I don't go, I could wet myself. Wow. They could also have symptoms of they want to pass urine. There could be reluctance in starting to pass urine, or even when they do start to pass urine, it could find themselves stopping a few times while passing urine. Sometimes it may be that when they are almost done passing urine, they start to dribble urine, and they just notice the dribble when passing urine. And sometimes it could also be that their stream, the strength of the urine that comes out becomes quite weak and is not as strong as when they were quite younger men. That being said, I've mentioned that, as this cancer cell starts to grow, they could affect structures surrounding the prostate. But in some cases, they could also go beyond the prostate in themselves, and that could result in, spread to the bones. And they could also, result in compression on the spinal cord. And people could also present with weight loss as well when the cancer cells are quite advanced.
Wow. That is very, very scary. Well, if you're joining us, we're talking about prostate cancer here. And like I said earlier on, if you've got any questions, please drop your questions or your comments or any contributions in the comment section, and we will look at that at the end of the program. I'm talking to Dr. Bola Adedeji in the house. She's a general practitioner, and we're talking about prostate cancer. So, men, if you're finding the fact that you're finding it difficult to urinate, or your urine, the way you urinate is very weak, it's coming out as being weak, anything that is standing out as not normal for you, if you're going to the toilet regularly more than you used to go, or if you are waking up several times in the night to pass urine, it feels you're not emptying your bladder, you need to check it out. It's very important to check it out. Thank you so much for this information, Dr. Bola. It's really, really eye-opening and very scary, like I said. But it's good that we know about this topic, because especially if it affects people, the black community, I think it's we're doing our own way to make sure that people are aware of what it is. Absolutely. How do you then access? So if somebody goes to the GP and seeing all these symptoms and signs, you're not being able to empty their bladder or going severally to the toilet, how do they assess prostate cancer?
All right. Thank you for the question. So in any man who is starting to have any of the symptoms that I've just listed earlier on, it's quite important that you definitely go to speak with someone about it. And obviously in this part of the world, that would be your general practitioner, which is usually your first point of call. And if a man is coming in to see your general practitioner, the sort of things that you would you would likely get your GP doing would include things like examining the prostate, if you have symptoms related to prostate, and that would involve doing what we call a digital rectal examination or parectal examination, as some people call it. So basically what this entails is you lying on the couch in a particular position where you're lying on your left side, and your doctor is basically putting in a finger through the back passage to have a feel of the prostate. And what they do, what we basically do is having a feel of your prostate to see what it feels like. Does it feel smooth? Does it feel hard? Does it feel rough? Does it look, does it feel bigger or larger than normal? Obviously, if it feels quite hard to touch, if it's feeling rough, if it's feeling, quite rough, and if I can feel any sort of nodules around it, then I would obviously be worried about that, and that would make me highly suspect if this could be prostate cancer here. Another thing that I could likely do, being a GP, would also be checking your urine to find out if there's any blood in your urine, because that could also be a pointer as well, or add on, to my findings or my suspicion of prostate cancer here. Another thing as well that would also be looking at doing will be what we call a PSA, which is called prostate-specific antigen, and this is a blood test that's used to also check this particular protein. So normally the prostate, being a gland, does release a particular protein that's called PSA, and some of this also goes into the blood as well. So by testing your blood, I'm also finding what this, how much of this you've got in the blood. And usually there's a particular limit that we expect, usually in an average man, which will be between 0 to 4. Of course, these values increase as men grow older, but at least we have that as the standard range, really. And if the numbers are particularly higher than 4, then I would have to look at your age, and based on that, I could see if I'm particularly worried about if this could be, prostate cancer or not. That being said, there are also certain things that could also result in this PSA, or prostate-specific antigen, as we call it, to be higher than normal. And that's because we also know that aside from prostate cancer, there are other conditions that could also affect the prostate. Because while we're quite, I know my sister has mentioned that the symptoms I mentioned earlier on are quite scary and, and quite worrisome, but another thing is that there are also different other conditions as well, and there's a particular one called BPH, benign prostatic hyperplasia, that's quite similar to prostate cancer, and men could basically just be having this and not particularly prostate cancer. But as this blood test I've mentioned, if it's quite high, that could be a suspicion as well. However, if I'm requesting for someone to have a prostate-specific antigen, there are certain conditions that need to be met as well. So basically, your GPs would actually be discussing the pros and the cons about this test with you, and if you do feel, just to help you to make a well-informed decision, and if you obviously feel that, yeah, you really want to go for it, then you go for it. However, you need to know that if at all you're going for this blood test, it is important to know that there's certain things that one should not do. So they would advise that basically you do not currently have any urine infection at that point in time, because obviously if there is urine infection, burning when you pass water or stinging, blood in your urine, high temperature, tummy pains, which could, at that point in time, it is very important that you're treated for the urine infection and wait for several weeks before you go for the test. Other things as well that could also result in a high PSA level as well could be symptoms of other infection, like infection of the prostate in itself, which is prostatitis. So as I mentioned, it's quite important that, if a man has got infection at that particular point in time, that it is tested and treated before going ahead to do this test. While you're going for the test as well, if you've made up your mind as well that you're going for the test, it's also important to also be aware that you need to avoid things like exercise, tedious or strenuous exercises about 48 hours before the procedure, absolutely. And also, it's also important to avoid sexual intercourse about 48 hours before the test, or even masturbation as well. Because if you do any of this and you flout these rules, then there's a chance that the result could come back falsely. So it could be falsely raised and you think you have cancer, but it may just be because of these conditions that you didn't adhere better. And that being said, there are false positive results and false negative results. So there's a chance that 1 in 4 men who have the test being negative may still have prostate cancer. Yeah, and if you do the test in about 4 men, if 3 out of them comes back high, it doesn't necessarily mean that you have prostate cancer as well, but it does mean that you still need to have further investigations done to be sure that you definitely do not have prostate cancer. So you have to be aware of these pros and cons before going ahead to go ahead with this blood test, definitely. So let's say I've examined you, I've examined your back passage, and I felt that the prostate feels quite hard, it's quite big, it feels rough to touch, and it looks quite abnormal and concerning to me. And I've done your urine test, and I could find only blood in your urine, no sign of infection. And I've also done this blood test, and your values have come back quite higher than normal. Then what next? That would be the thing. So what we do at this point, if either of this has come back abnormal, is to refer you to the hospital to see a specialist, which we call the urologist. So these are specialists that deals with men related with matters related to the prostate, like prostate cancer, and they would then assess the men involved for things like this, really. So for some people, there's a image on there, if you can see. So I think I've talked a bit, so at least the picture you can see in front of you may be helpful for you to have a look at it. So if you look at the large, there's a structure, there's a white round structure at the forefront. Yeah, that's a pubic bone. So if you put your hand just down below your tummy, you start to feel something a bit harder than your normal soft tummy. So that's your pubic bone. That's basically where the hip bone comes together to fuse together. And just behind that is the bladder, which is quite a larger structure. And you can see that there's a very thin line that comes just beneath it. And just below the bladder, you can see that walnut-shaped structure, which is your prostate. And you can see just behind that prostate in itself, you can see the bowels. So that's basically where the poo comes in through. So we basically are putting the finger through that back passage to have a feel of the prostate, which is very, very close to the bowel, to have a feel of what the prostate feels like. So yeah.
Wow. Dr. Bola, this is a lot of information. And you know what? The good thing about it is they can always go back to our YouTube channel. So if you go to our YouTube channel, Oasis of Love International, you can always go back to this program, and you can always have a look through around it, because at the moment it just seems like too much to take in. And I know you want to give us everything. We also want to know everything about it, because it's really important that we know, we know these things, because it affects us, and it affects each of us. I want to believe have a man in our life. So and I want to believe that it's a good information. So thank you very much for going that deep. And the fact that for me, what came out is the general examination. It's quite a lot, to know that for them to be able to detect whether you've got a prostate cancer, you're having a rectal stimulation, you're having some blood tests, you're then going to see your urologist and all that. Wow, that is so interesting. And also to find out that there could be also some fake results, So, amen, if you're out there and you're listening to this program, when they say no sex, or what was the other
no masturbation, no sexual intercourse.
48 hours, please, it's for your own good, just so you know what exactly is wrong. And then you mentioned briefly that there are other diseases that's not necessarily cancerous, so that a man could have. I know you've mentioned a couple, the BPH and the prostatitis. Is there any other thing? And do they have these same symptoms? So if a man have all these symptoms, it's not necessarily the fact that he's got a cancer. So it's still possible for them to go and check it out to see exactly what is going on. Yeah. Is there any other thing that they should be looking out for? Yeah.
So that's a very good question that you've asked. So while I've, said all of these things and it could sound quite scary, there's a very, very close differential, as we call it. So there's another typical symptom that could, there's another medical condition that could actually present very, very, very similar to the prostate cancer, and it's called the BPH, as my sister said. It's called benign prostatic hyperplasia or benign prostatic enlargement. So what this basically means that benign basically means it's not something serious. Prostatic means prostate, obviously, and enlargement just means that the prostate is quite larger than normal. And from the word benign, it just means that it's not a serious condition. So it just means that, as men grow through the years, their prostate could become bigger and bigger through the years, and that could then start causing pressure symptoms on the tube that passes urine down to the from the bladder out of the body, and they could have some of these symptoms of urinating frequently, feeling, that they're waking up at night time quite a lot to pee, feeling that, after they've gone to the loo to pee, that, they don't feel like they've completely emptied their bladder, or feeling that there is, basically most of these symptoms that we've mentioned earlier on, really. So it's quite important that as much as you've noticed these symptoms, you're not too worried about it, that this is always prostate in this case, because it could just be what we call benign prostatic hyperplasia. But it is very important that you do get yourself tested, because it's, after we've done all of these tests, that we could easily then put it down to, just a benign condition that we could manage with, either medications, depending on the severity. It may not require treatment, it may require medication, and it may, in some cases require surgery. But yeah, it's not something that will spread to any other part of the body. It's not something that requires very serious medications or treatment like prostate cancer.
And I quite like the fact that you're emphasizing the fact that they need to go. Absolutely. Because most of our African men, they don't go for checkup. They don't, they wait until it's very late for them to be able to go. But one question that I need to ask you, Bola, is it advisable to go for can you go for a regular checkup for prostate? Or do you have to wait to see all these symptoms before you go? Or is it like, your regular medical checkup every year that you go for? That's one question. Another part is, can the doctor invite you at a particular age to come for a check? Or is it just that they're waiting for you to see symptoms, or they're waiting, in UK for instance, they're waiting for you to call them that you want to come for this check? What's your advice on this?
That's a very good question, actually. In terms of screening in the UK, it's something, there's no particular or specific screening agenda developed yet, but obviously it's quite in process. So at this time, no one would particularly call you to come have any test or examination, which is why I still, reinforce on the fact that if you've got any of these symptoms, it's very, very important that you go to have a chat with your GP. Now, if you are above the age of 50 and you go to your GP and you feel that you have any of these risk factors that I mentioned earlier on, so if you feel that you're black, or you've got a dad or brother who's got prostate cancer, and you do go to your GP to request the PSA, which is the prostate-specific antigen, your GP is going to have a chat with you about the pros and cons of this testing, and your GP will go ahead to do the test. Most often than not, it's unlikely that they will decline you the test, as long as you're making a well-informed decision based on the information that you've been given. If you're less than 50 and you do not have any of the symptoms, and you're coming to me that you just want to do a prostate test or PSA test, it's not something that we would routinely do, if that makes sense. But if you do have the symptoms and they are in line and they're quite, obviously sinister, then I may look at, all of these risk factors, family history of, prostate cancer. If you're having symptoms at the time, then I may, have a look at it. But it's not something that your GP will routinely do. So if you're 40 years old and you've just walked in to see your GP and asking for a PSA test, and your GP is saying, I don't think you need it at this time. Do not be upset with them. It's just that you don't really fit, into it. Because as I said, absolutely, because as I said earlier on, the test could also, come back being false positive, it may be elevated wrongly. And if it's high, you know that you do have to go to the hospital. So this just puts you through unnecessary, series of tests really, to then finally find out that, oh, I don't think you've got it. So rather than, put yourself through that, or rather than, the medical professional putting you through that, really, it's quite important that, mostly if you are above 50, if you have any risk factors, family history of, prostate cancer, if you're Black, obviously you have any of these symptoms, absolutely go see your GP and have a chat about it. And we could consider, this testing to be done, really. So,
Okay. So, if your viewers at home or online or wherever platform you're joining us from, you've heard it all. So if you're over 50 and you're feeling any of these symptoms, or even if you're less than 50 and you're having all these symptoms that we have just talked about, please, 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 and if you've got your risk factor, you're from a Black background, you've got an history of prostate in your family, go check it out with your GP. Thank you so much for that. I've got some questions here that people have asked. I know you've talked about some of them, but I'm just going to ask them anyway. So one of the questions is, how do I know that the symptoms I'm having is BPH and not CA and not cancer?
So that's a very good question. So you may not know. So one of the things that's why it's very important that you go to see your GP. So one of the things that could help me, so if you come to me and you've mentioned these symptoms that I'm aware that is quite related to your prostate, then I would like to examine you. I know it could be quite an uncomfortable or embarrassing procedure, and that's why I've noticed that most men, sort of decline it. Yeah. But the information that I get from this helps me a lot, being a GP, to know when to refer you, what treatment to start, and how quickly I should refer you. So if I'm having a feel of your prostate and it feels larger than normal, but it feels quite smooth, and it's smooth, I may not be particularly concerned. I would probably be thinking that you've got what we call BPH, or benign prostatic enlargement. But if I can feel that it feels quite irregular, it feels quite nodular, it feels quite rough to touch, then I am particularly concerned. Then I'm thinking, could this be prostate cancer here? So those are one of the things that will help me, especially if you have, some of the symptoms that could present with prostate cancer. Also, for someone who's got benign prostatic hyperplasia, I wouldn't expect you to be losing weight. I wouldn't particularly expect you to be very fatigued and tired and losing appetite and losing weight. So if you're having any of these symptoms, then I may be worried that could this be prostate cancer. If you've also got a family history of prostate cancer and you're coming to me with any of these symptoms, then definitely I want to, first be sure that you do not have prostate cancer by going through this, test or referral before it is then put down to BPH. Also, if you're particularly having blood in your urine and you have no symptoms, then I would want to refer you as well, if you're quite an older man, to your urologist to also do further investigations to be sure that this is not just BPH, that because this could be prostate cancer. So there are other risk factors that may be in line with BPH and rather than prostate cancer. So while I've mentioned earlier on that more of the risk for prostate cancer are things like Black ethnicity, older age, and people who's got family history of prostate cancer. For BPH as well, it could occur in men who's got risk factors of diabetes. If they have family as well, dad or uncle has got BPH, that's also one of the things that increases the risk. Obesity, you being overweight beyond, and your BMI is beyond 30, that's another risk factor for having BPH. So absolutely.
Wow, that's another one. Obesity. Oh, the Lord will help us. Another question, Bola, is why can't I control my urination as I grow older? Because they hold their urine.
Okay, so that's a very good question. So I mentioned earlier on that the older men get, the larger their prostate gets, and the risk of these changes happening in the prostate. So a man not being able to control the urine may be due to quite a number of things, yeah, from things like an overactive bladder to things like, could it be urine infection, yeah, if it's obviously something that's just occurring within a short term, to things like, prostatitis, to things like benign prostatic hyperplasia that we've just talked about, and to, other more sinister things like, prostate cancer, yeah, and yeah, obviously those could be, different, they're quite a number of reasons, really. So that's why I mentioned earlier on that we don't just take one symptom in isolation. We have to look about all the other symptoms that you are having at the time to then help us to, make a better plan as regards what we think may be wrong and what to do, really, at that point in time.
All right, so if you're the one that has asked this question, please go and see your GP. It's very important to go and find out what's going on. Like Bola said, might not necessarily be a cancer. It could just be a BPH. So another question that we've got here is PSA the only investigation to confirm prostate cancer?
Lovely. So thank you for that question. So the things I mentioned earlier on, so the digital rectal examination, examining your back passage, checking your urine test, and doing the blood test called PSA. Those are the things that I can do for you as a GP. So I did mention that if any of them comes back abnormal, that raises my suspicion of, prostate cancer, and I'm referring you to see a urologist. So the next thing is what then happens when you go to see a urologist. So there are a few things that the urologist could do for you to confirm the presence or the absence of prostate cancer. So in the past, the first thing that used to be done used to be what we call biopsy. So this is sticking in a needle through your back passage or through, the structures just beneath the testes to check, to down straight into the prostate, to take some snips, a tiny little amount of cells, and then go to test it under the microscope. But now things are evolving now, and now it's now been said that the first thing that your urologist may likely do here would be doing an MRI scan. So this is basically going through more like a channel. So sorry, apologies to those who are quite claustrophobic. So it may involve you, lying down on the bed, going through a tunnel, which would then help to have a look, scanning your prostate basically, to have a look if there are any abnormal cells, abnormal growths that they can see, if the shape of the prostate looks quite abnormal, and if this has also spread to any structures around the prostate or beyond the prostate. So yeah, the MRI scan is less invasive, so it doesn't cause as much, distress as much as the biopsy. But should the MRI scan then come back abnormal, then in this sort of case, then your specialist may then be looking into doing a biopsy, which is then sticking in the needle either through your back passage, but then usually it's more ultrasound guided. So there's an ultrasound scan that's helping to see the exact place or the appropriate place where the needle should go into, to take out these snips or samples from the prostate and then sending it to be tested under the microscope. And obviously, based on what your specialist then finds out, so if the specialist does find out that there's an abnormal result on the MRI scan, or there's an abnormal abnormal result on the biopsy, then they do confirm what, if the patient has got prostate cancer, what type of prostate cancer it is, if it's just a mild one that, that they just need to be monitoring, or if, which we call watchful waiting, they just watch you and observe the growth through the years, and they should it be someone who is quite elderly or has, 1001 medical condition, and they feel that, treating the prostate cancer at that time may not be beneficial, they may just keep an eye on such person from time to time and watch for any changes. And should there be any changes, they may start to reassess again and see if they need to, give any further treatment. There's also, so we call that watchful waiting. There's also something called surveillance, where the specialist may require that, the individual does test from time to time. So it could be every 6 months, to a year, where they will just do an MRI scan or recheck the PSA levels just to see, is the PSA level climbing, or, is the prostate cancer spreading, and do we need to then intervene? So this also could be done for someone who has a mild prostate cancer and, they really don't have much symptoms, or they don't want to go for any surgery or any other treatment at that time. Other things that your specialist may do may include surgery, which is basically cutting out the cancer cells out of the body, and that could be done, through various methods these days. So it doesn't necessarily have to all be opening up your tummy. To do this. Other things as well could include radiotherapy, which basically involves using high intense energy to kill these cancer cells. They could also treat you with hormonal therapy, which is basically giving some sort of hormone treatment, which could be in form of tablets, to be given, in form of medications, really, to be given to shrink these cancer cells. But usually they don't give it alone. It's usually alongside other treatment that I've mentioned above. And there's also what we call chemotherapy, which is basically giving some medications or chemicals basically through the vein. Some people may know it as drip or, IV fluid, but basically it's basically giving it through that route, but they have specific medications targeted to specific cancer cells. So yeah, those are the sort of things that you may expect from your specialist should one have prostate cancer. But yeah, as I said, prostate cancer is quite slow growing, so not a lot of them are aggressive. But then we've also noted that in the Black ethnicity, most people do present late, and by the time that they do present, there's a chance that it may have become advanced and it may have gone to spread. So it's very important that once you start to have symptoms early enough, that you don't just ignore it, but you do go to your GP to have a chat about it. So, yeah.
Wow. It's actually a very serious condition, Bola. And learning about prostate cancer today, it has opened my mind and my eyes to so many things that some of us take for granted. The fact that we can go to the toilet and we can just pass our urine quietly and walk out. Some of us just take it for granted. And I know I'm talking as a Christian, obviously, but some of the things that people go through that you just feel that is normal, but for some people it's actually a struggle for them. Is there anything, because we are rounding up now, so if you still have some questions that you need to drop with us, can you please drop it in the comment section, because we're about to round up. But is there anything that we, the Blacks, are doing? Is it our diet? Is there anything that we're doing, our way of life, that makes us to be at such a risk of having this prostate cancer?
That's a very good question. Unfortunately, the particular reason why Blacks have it commonly is not yet known. There's been different theories of cost, and some people have linked it to some possible genes, but the exact cause as to why Blacks have it is still not quite known, really. But yeah, unfortunately, it's just common out in Blacks. So yeah.
What a shame. Okay, I've got one more question here. And it says, I read online some time ago that masturbation can cause prostate cancer. Is this true?
Well, that's a very dicey topic, but scientifically, it's not one of the causes, really, of prostate cancer, unfortunately. So, yeah.
Okay, so you've heard it, that masturbation doesn't cause prostate cancer. However, as a Christian, should you be doing that? That's left for you to decide. It might not be causing prostate cancer, but it might be causing some other things sexually that is affecting you, either psychologically or otherwise. We'll leave that topic for another day. So we're still here. We're seeing you. So we're going to be throwing some, just to see if you're following us, if you've been following us. So we're going to be throwing some questions. So you can answer them in the section below, just to see if you're following what we're saying. Any thoughts, any more thoughts about this question before we round up? Any more things that you need to say to that we haven't asked or that we haven't covered?
I think we've said most of it, really. We've mentioned, we've basically talked about prostate cancer being one of the commonest, type of cancer in men. We've talked about it's been We've mentioned the fact that there's no particular cause, really. We've talked about, things that could increase one's risk of having prostate cancer. We've talked about the sort of tests or, sort of assessment that your GP could do for you if you have any of these symptoms. We've mentioned the fact that, the symptoms we've mentioned or discussed above is not all specific to prostate cancer. So if at all you're having any of the symptoms, does not mean that you should particularly be overly worried, but obviously it is important that you do get it checked out. But there are other conditions at a very close one, which is called BPH, which men could have, and there are other conditions as well that could mimic symptoms, like prostatitis, which is infection of the prostate, urine infection as well, which is quite important that you do not have any sort of infection when you're doing some sort of test. We've talked about what could be done as well if any of the assessment that your GP does is abnormal, and how important it is to go to see your GP, and then your GP could refer you to a specialist where you could have further tests done, like an MRI scan done. If it comes back all normal, obviously you're discharged back to your GP and it's a win-win for both of us. If it does come back abnormal, then they would likely be doing further investigation tests, which includes a biopsy as well. And we've also talked about the possibility of treatment, which could involve just watching and waiting, because as we said earlier on, prostate cancer is one of the good types of cancer. So it's quite slow growing and people could have it through the years and it may not necessarily, kill them. They may not die from it. It's only a very, very few percentage that becomes quite aggressive and could spread to other parts of the body. And we've talked about the different treatment that the specialist could offer, really. We've also talked about the screening. As much as there's no particular screening test, there's the PSA that men who are above 50 could request from the GP and they could be considered for it, especially if they have any of the symptoms or if they do have any of the risk factors. That being said, if you're less than 50 but you've got any of the symptoms, even though you're less than 50 does not mean you should not go to see your GP. Please still go to see your GP. The GP would assess your risk if you need further testing and referral, or if this is just BPH, which could be managed, basically by your GP based on the other assessment and tests that could be done. Basically, I think, we've covered most of it, really, to be honest,
And I just want to say thank you so much for your time. I know you're a very busy lady, and, on behalf of the medical department of Oasis of Love International Center in Wolverhampton, we want to say thank you for giving us this time. I want to say thank you to everyone that is watching us online as well on our different platform. We're going to be coming again sometimes very, very soon with a different topic. If there's any particular topic that you want us to treat, please drop it in the comment section and then we'll be happy to talk about it. If you've got any more questions, please still feel free. And Bola is going to be throwing us some questions to see that you're actually getting it. So please, at the end of the day, try and drop those questions in and then drop your answers in the comment section.
All right.
One more question, Dr. Bola, sorry. Okay, so I have heard that running or jogging can increase your risk. Running or jogging?
I won't say it increases your risk. However, say you've come to me, you've got any of the symptoms, I've examined you, and I want to do the PSA testing for you, I'm going to advise that you do avoid rigorous exercises. So that could involve, intense jogging or running, obviously. Because that could give you a falsely raised PSA result. So that's one of the conditions that I would say. But being physically active, absolutely, that's beautiful for your body, really. So I would.
So don't use that as an excuse not to go and jog. Go and jog and keep fit. So yeah, Dr. Bola, up to you with your question.
All right, so let's see. Let's see if you've been following so far. So first question, please feel free to put your answers on the chat boxes on YouTube or Zoom, wherever you are. So the first question, the prostate gland is found in women, true or false?
Really? You should know this. The prostate gland is found in a woman. Is that true or false? If you've really been listening, you will know this.
You can type your answers A or B.
A is true and B is false. There's a gift. There's a gift for anyone that gets the most answers right.
Any answers? A or B?
So most people said B.
False, lovely, false. So yeah, absolutely. We did say it's only found in men.
Not women.
Yeah. The shape of a prostate is likened to A, an orange, B, a banana, C, a walnut, D, an apple.
Okay, good question. I think it's an orange, Dr. Bola.
Are you sure it's not an apple?
No, it's a banana.
You sure?
Yeah, I think it's a banana.
Let's see what people are saying. Let's see the responses. Okay, so I think majority are putting in C. Absolutely. The prostate gland is a very small structure and it has the look of a walnut. So yeah, well done, guys. The next one, what is the full meaning of PSA?
Okay, it's becoming...
A, prove Samuel army. B, prostate specific antigen. C, Paulson assessment. D, prostate salt assessment.
It must be proof Samuel army. Because we're Christian, isn't it? Samuel is in the Bible. Come on, guys.
And Paul is in the Bible
Don't
as
fall
well.
behind. Oh, okay, Paul. It could be Paul.
So is it Samuel or is it Paul? Sister
Samuel or
Toy.
Paul?
Okay, so most people are going for B. Yeah? Yeah, absolutely. It's prostate specific antigen. It is PSA and it is a blood test. Well done. So yeah, the prostate can be felt through the back passage. A, true. B, false. The prostate can be felt through the back passage. A, true. B, false.
It must be false. Because I have a reason.
Okay.
It must be false, Bola.
Any answers? Any more answers? I can see someone saying false. Somebody has said true. Okay. So there's a tie. Is it true? Is it false? So yeah, it is true. The way your doctor would examine you to have a feel of your prostate is through your back passage, which is called through your anus or your rectum to have a feel. Remember the picture I did show earlier on? The prostate is very close to the back passage. So yeah. The prostate cancer is mostly slow growing and is curable. A, true. B, false.
I know that.
Sister Toyi knows the answer already. So,
But I'm not going to say
any responses?
yes.
Any responses? I can see a lot of people putting in true. Yeah. So absolutely, prostate cancer is quite slow growing. It could grow for, slowly for quite a number of years, and it is curable. Absolutely. I think that's about it, really. So, summary, we've mentioned that prostate cancer is curable. If you are above 50, you've had any of the risk factors discussed, or any of the symptoms mentioned, please book an appointment with your GP to discuss. Yes.
Thank you so much, Bola. I've thoroughly enjoyed myself. He's been informative. It's been scary highs and lows for me. And you know what? Overall, he's been very interesting and very interactive. For those of us that are watching us online on our various platforms, You know, I'm sure you have enjoyed yourself thoroughly as well. And we're going to be leaving you just now. If you still have anything, any questions, please drop it and we'll be treating it. And also, like I said earlier on, if you've got any other topics that you'd like us to discuss, feel free to drop it as well, and we might just have a look at it one time. So until we come your way again, yours truly is Toyin and Bola, and we're saying bye.